Joining us now is Dr. William Schaffner. He is a professor of infectious diseases at Vanderbilt University School of Medicine. Dr. Schaffner, good morning. Let's start talking about the variant first discovered in the UK, 2 cases, one in Colorado, one in California. Both of those people are not known to have traveled any time in the recent past. So what do you make of that?
Well, David, that means this virus has crossed the ocean and is spreading here. Obviously, these people didn't travel to the UK to get it. They must have acquired it from a contact here, so it's already spreading. And we've seen, obviously, a surge of COVID throughout the country, and this new variant here and there may be contributing to that. But the important thing to remember is, although it's more contagious, masks, social distancing, staying away from groups, staying home can dampen the spread of this virus, just as it can dampen the spread of the standard COVID virus. So we really need to behave in an appropriate public health manner.
Dr. Schaffner, are we doing enough testing here in the U.S. for that new variant?
I wish we were doing more. Our British cousins do much more of that than we do here in the United States. And we're ginning up and doing more as we speak, but still not enough.
Look, President-elect Biden made a promise that he was going to do 100 million vaccines in the first 100 days he was in office. You think that's achievable?
It's theoretically achievable. I wish he had said we're going to do the best we can. I don't like to overpromise and then underdeliver, because there's a lot of discussion about that right now. But I think across the country, our vaccination programs are just really getting started. Everybody started very conservatively. We didn't want to foul this up. We learned how to do this, and I think all of our programs are going to accelerate substantially going into the future. So that's an aspiration. I hope we can make it.
When do you think, doctor, that the general public, us regular folks, are going to be able to get a vaccine?
Regular folks who don't have any underlying illnesses and are, for example, middle-aged and younger adults, I think sometime late spring, everybody will be able to get it. First, we're going to get the first responders, and then, of course, people who are older and have underlying illnesses.
Let's talk about this, Doc. China approved its first vaccine developed by a Chinese company. Do you foresee that vaccine being used here in the U.S.?
David, I don't think here in the U.S., but the Chinese have already reached out to many developing countries and are creating relationships with them. That's called vaccine diplomacy. They're making friends by offering to provide vaccine around the world. Very clever on their part.
Doc, last question. I keep running into people when I'm on the road covering coronavirus who don't want to wear a mask, and they don't think that masks work. What do you say to those people?
I sigh a little bit, recognize that they have that notion, and it's often deeply baked in. But I try to tell them masks protect them and protect the people around them. It really is the thing to do. Try to put politics aside. This has a political veneer. The virus doesn't care whom you voted for. It's just happy to spread. Let's all wear masks and do social distancing. That will help bend the curve and make the new year a happier one.
Happy New Year to you, doctor. And I hear you're getting your coronavirus shot today. Good luck.
I am. Thank you.